Why does fatigue stop self-care for depression and anxiety? Imagine feeling so drained that even the simplest tasks seem impossible. That's what fatigue can do to someone with depression or anxiety. It's not just feeling tired after a long day. It's a deep, overwhelming exhaustion that affects both body and mind. When fatigue hits, it can make it hard to get out of bed, eat properly, or even keep up with personal hygiene. This exhaustion saps the motivation and mental clarity needed to care for oneself, creating a cycle that's tough to break. In depression and anxiety, fatigue happens because of several interconnected reasons. First, changes in brain function play a big role. Depression often involves dysfunction in the frontal lobes, which are responsible for planning, decision-making, and problem-solving. When these areas aren't working well, it becomes harder to start or stick with self-care routines. Second, chemical imbalances in the brain, especially lower levels of neurotransmitters like serotonin and dopamine, reduce feelings of energy and happiness. This chemical drop makes a person feel more exhausted and less motivated to act. Physical symptoms also contribute. Sleep disturbances are common in depression and anxiety, leading to poor rest and less energy during the day. Poor nutrition, especially if someone isn't eating enough or lacks essential nutrients, can worsen fatigue and depressive symptoms. This creates a vicious cycle where exhaustion makes it harder to take care of oneself, which then worsens fatigue and mood. The emotional and cognitive burden is another factor. Negative thoughts, feelings of despair, and constant worry consume mental resources, leaving less energy for self-care. This mental fatigue makes even small tasks seem overwhelming. When someone feels emotionally drained, they often avoid activities that could help improve their mood, like exercise or socializing, which then perpetuates the fatigue and emotional struggles. Physical activity can help boost energy and mood by releasing endorphins, but fatigue often discourages movement. Without regular activity, the cycle continues, and symptoms of depression and anxiety can worsen. In cases of brain cancer or neurological conditions, fatigue can be even more intense. Tumors, treatments like chemotherapy or radiation, and neurological damage can cause severe tiredness that impacts thinking and motivation even more. For these individuals, managing fatigue requires a team of healthcare providers. They may recommend symptom management strategies, nutritional support, and gentle physical activity as tolerated to help regain some energy. Overall, fatigue stops self-care because it weakens the brain's ability to plan and motivate, drains physical energy, and overwhelms emotional resources. Addressing fatigue involves medical treatment, lifestyle changes, and support to help restore energy levels and improve overall brain health. If you or someone you know struggles with this, it's important to talk to a healthcare professional for personalized advice and effective management strategies.